Hi, my name's Steve McLaughlin and I work with CMF Global. How big is a heart? Why would I be asking a bunch of healthcare professionals that question? Of course you know how big a heart is. How about if I ask you the question, how big is God's heart? Immeasurable in its reach, in its love, in its compassion. Here at CMF Global, we're in the business of growing hearts. Did you realise that? However tiny our hearts are to start, CMF Global is about helping us learn together about how high and wide and deep and long is the love of Christ. Enough that God sent his Son across the divide to make known his immeasurable love. And as Christ's followers, he wants us to have that same love, that same heart. So we're about growing hearts. Whether we're on baby steps, our Who's My Neighbour course kickstarts that growth. Whether it's time for a reboot through our Medicine Mission and Me, a short retreat, which is coming up soon. Or whether about crossing the divide as Christ did in being willing to learn about the needs of those in our consulting rooms from other places, displaced people who need to know the love of God. Our refugee and asylum seeker health day course is for you. Whether it's being able to speak, our global advocacy work is about translating this heart into spoken action. Or through our good practice guidelines work, ensuring that we reflect the heart of Christ. Whether we're getting ready to cross continents to join in making this love of Christ known, we more than many have a strategic advantage of having skills that many countries want. We can access places where many can't. Is your heart big enough for that? Or at least to consider how and where you could serve either short or longer term. Has your heart grown enough for that? CMF Global is about supporting and equipping in the heart growing business, walking alongside and training through our global track and our developing health course. And those of you with big hearts can give your time to mentor, to pray in your catalyst groups, to give, to support our heart-growing business. Join us in this business. Chat to me more about how you can engage in this critical work. Thank you.
We are CMF Students. Uniting and equipping Christian medical, nursing and midwifery students to live and speak for Jesus Christ. This last year has been challenging for healthcare students across the UK and Ireland, with lectures happening online, changes to placements, moved exams, and students graduating early. CMF National Conference was cancelled this year, which we were gutted about. And this year's freshers have not had a typical start to university. Connecting with local churches and campus Christian groups has not happened as it normally would. In spite of all of this, our groups have been persevering. They've been supporting one another, meeting virtually, and together learning and growing in studies and faith through difficult times.
Blessings have been having so many people still wanting to be involved. We're still seeing people coming along to prayer meetings on Zoom on Mondays, still seeing folks going to the national meetings. That's really cool. Challenges, just so much of our CMF was based on what we did together, so meeting up every month and sharing a meal together, sharing a talk together, meeting up for walks and things like that. So much of it was based on what we did sort of in person with each other. A lot of meeting up for dinner in people's houses and things, and so it's been a bit of a shift trying to still foster that sense of community without actually being able to be close to one another in that way.
Thank you for your support of CMF students through prayer, mentoring, membership and more. We hope that you will continue to support the next generation of Christian medical, nursing and midwifery students to live and speak for Jesus Christ at university and beyond.
How do you keep communicating in lockdown? Well, you go online, and as you'll have seen over the last 12 months, members have been connecting over video conferencing apps more than ever. We've run digital conferences and discovered new ways of using existing technology. It's not the same as face-to-face, but I think it'll always be a useful tool, and we've developed a useful sets of skills that we're all going to be using more and more into the future. But what do you communicate? Well, when Christian health professionals have been amongst those at the very front of the front line of the response to COVID-19, it's been your stories that have been needed more than ever before, whether that is in podcast, video or the written word. So a big thank you to all of you who have contributed to our 40 Voices from the Frontline podcasts. For those who wrote for our publications that came out during the last year, those who spoke to the media, especially the Christian media, where the voice of Christian doctors and nurses in particular were heard time and again. You told the story of what was happening in your hospital and in the community. You helped to dispel misinformation. Your voices were widely and clearly heard, and they made a real difference. It wasn't just about COVID-19 either. We've shared discussions on racism in the NHS, how we change workplace culture in a Christ-like manner, and how climate change and health are interlinked. So, where do we go next? Well, we know the CMF website is, well, let's be honest, not really what we want it to be at the moment. We need a new website that helps all of us to connect, get hold of resources and share the good news. Watch this space in the coming months. We'll be overhauling other publications in the next 18 months as well, developing new video resources, finding fresh ways to communicate the voice of Christian health professionals to the wider world. You have a story to tell, and we want to help you to get it heard even more widely.
At CMF, so many people volunteer their time, money and gifts freely, sacrificially and joyfully, echoing God's volunteering of himself to us in Jesus. And we want to see the heart of a volunteer through all that we do. And we're so grateful to God for the many who give time on committees, leading tracks on local teams, serving in so many ways. Now, to deliver CMF at a local level, our vision is to see a catalyst team in every region. We have 13 teams comprising so far over 60 members in total, and more than 60 attended our online conferences in September and in March in the last year. You can check out highlights in the link on the chat. This is an exciting and foundational part of how CMF is moving forwards. Now, some incredible volunteers we have here at CMF include 17 Deeper Fellows over the last year, 5 who finished last summer, 12 who are finishing this summer. And they've been involved in so many aspects of what we're doing, from research to ethics to social media. And alongside this, they receive bi-weekly teaching and training. Could you spread the word about this exciting opportunity? As we seek to train and equip volunteers, we have 4 other training tracks running. A 3rd speakers track in Scotland, a new health and justice track, a 3rd global track, and a 2nd evangelism and apologetics track. And alongside our training of those on committees, that's over 120 people being intensively trained to become leaders of the present and future as Christians in healthcare. That's in the last year alone. And we're developing a leaders and management network after a successful joint event with the Global Leadership Network in March. Internationally, CMF is part of ICMDA, and recently I trained 20 leaders from 20 different countries to develop volunteer leaders through the wonders of Zoom. God is on the move as we seek to find and equip those with the heart of a volunteer to do the works that God has prepared in advance for them to do.